everyone. I'm Kristen Jill.
And I am Kathy Noel, and we are student advocates from San Pedro College. And today, we will be talking about something that affects us all, whether you be a student, a teen, a parent, or even a grandparent. And it's none other than vaccinations.
From its humble beginnings to life-saving vaccines today, we want to show you why it matters, to debunk myth, and to hear real voices of Filipinos.
And of course, we will be joined by our medical experts, Dr. Vox and Dr. Vex, who will be guiding us all throughout the journey. So now, let's dive into the origin of vaccination.
Over 2 centuries ago, in 1796, Edward Jenner observed that milkmaids who had contracted cowpox were protected from smallpox. With that simple, bold insight, he administered the phrase vaccine. That tiny step triggered a global revolution in disease prevention. From smallpox, humanity moved on to develop vaccines for many diseases: polio, measles, diphtheria, pertussis, tuberculosis, and more. What was once a deadly threat became preventable. Vaccination is one of the modern medicine's greatest public health successes.
Globally, vaccines prevent 3.5 to 5 million deaths every year, and that is according to the World Health Organization.
And for 50 years, immunization has saved 154 million lives. And that is 6 lives in 1 minute.
Here in the Philippines, recent data 2024 shows fully immunized child coverage dropped to only 64.85%, far from the 95% target recommended by World Health Organization for herd immunity.
That gap leaves many children vulnerable. In fact, in 2023, the country saw a sharp rise in measles cases, a nearly 299% increase compared to 2022.
These numbers are not just statistics. They represent real children and families exposed to preventable disease.
I think vaccines are very important in today's generation because vaccines can help us to prevent from serious diseases that can spread quickly, especially COVID-19 vaccine. Sa akin. I can't blame them. Siguro may mga traumas na rin sa kanila or like pananaw nila na nagkasakit sila if may vaccines and all. Pero as a nursing student, I have the right to encourage them to take vaccinations, explain to them na why is vaccination important, like it prevents diseases that can spread quickly. So, ayun, ano sa kanila na helpful ang vaccination for us.
Nakatry na ba ka magpabakuna, Nay?
Nakatry na ko pero ginukdanay kay mahadlok ko sa dagom. Ano lang. Hadlok jud ko kay sa dagom pagkakita na ko.
Pero nagpabakuna ka ato, Nay.
Nakabakuna ko kay na agtan man ko. Ko naman jud ko nila. Corner naman jud ko nila.
Pero dili unta ka magpabakuna.
Dili unta kay mahadlok ko sa dagom. Mo to pangahadlokan dagom. Pero sa diay na man okay na ko. Magpa-inject na ko kung unsay man ako.
Unsa ka importante ang bakuna para sa imo, Nay?
Importante jud kaayo kay makatabang sa lawas kung isa pa sa karon na panahon sa atong immune system.
Factors may influence these differences of views about vaccines such as myths. Let's address some myths that cause fear and hesitation about vaccination.
Vaccines cause severe side effects. While this is a fact, most reactions are mild. It can still cause soreness or slight fever, but it goes away within days. Serious adverse events are extremely rare, and global surveillance shows that vaccines benefits far outweigh risks.
The human body, especially a child's immune system, encounters thousands of germs every day. The number of antigens in vaccine is tiny compared with daily exposure. It's safe and well within what the immune system can handle. Health experts agree. False. Vaccines train and strengthen the immune system. They safely expose you to a harmless version or part of the germ, enough for your body to build defenses without risking severe disease.
On the contrary, natural infection can lead to severe complications like hospitalization, long-term disability, or even death. Vaccines give immunity without those risks. That's why millions of lives have been saved, both young and old.
Natural infection can lead to death or disability. Vaccines give protection without the suffering.
A child's immune system encounters thousands of germs every day.
Vaccination isn't just a personal choice, it is a collective responsibility.
Share facts, not fear. If you heard the myth, ask trusted health professionals.
When we get vaccinated, we protect those who can't, the infant, the immunocompromised, and the elderly.
If you know someone unvaccinated, encourage them. One conversation can save a life.
Protect yourself.
Protect your loved ones.
Protect the nation.
Protect the future.
Get vaccinated today!